Section 4. Intimacy Styles and Sexuality. Intimacy is the capacity for healthy bonding, closeness, connectedness, and self-disclosure with a reciprocating partner. Intimacy is greatly impaired when the cognitive schemas for trust, safety, esteem, empathy, and power are injured. Two components make up the construct of intimacy. Intimacy involves intrapsychic, quote-unquote within, components, such that traumatized individuals who perceive themselves as damaged, defective, unattractive, unintelligent, and so on. They are therefore impaired in finding healthy pair bonds. Once a pair bond is established, each individual's intrapsychic intimacy tapestry is superimposed on the others, creating a complex interweaving of interpsychic intimacy. Sometimes therapists can focus on interpsychic intimacy and help restructure the behavioral interchanges of couples through caring days. Other ways in which intimacy can be strengthened include the teaching of problem-solving skills, active listening skills, language, the expression of feelings and desires assertively and directly, and so on. Although this is necessary, given the relationships trauma victims create, it is rarely sufficient. Sexuality is one manifestation of intimacy, which includes the capacity of each individual to tolerate the vulnerability, closeness, trust, and perceived release of control, which is inherent in sexual interchange, as well as the fluidity of closeness and distance that is inherent in the sexual relationship. That is, if two partners live as roommates with little intimacy, it would be unrealistic, and perhaps pathologic, to expect passion and vulnerability in the bedroom. For such couples, sex is a reasonable barometer of their intimacy styles outside the bedroom. Similarly, if they are not friends, or if they have unresolved resentments or active rage, sexual interaction would reflect these problems.